Hello, this is Dr. Marty Klein with more Sexual Intelligence. Today I want to address whether schools should be allowed to deceive parents. I trust most children to accurately know if they're hungry, cold, or need a bathroom. I don't trust children to accurately assess if they require medicine, should take math class, or need to lose weight. I trust children to know if they feel uncomfortable, unhappy, lonely, isolated, or different. I don't trust children to know the best ways to resolve those feelings. After all, it's our job to teach them. And the more extreme their suggestions are, the less we should trust them. I don't trust children to accurately know if they need gender reassignment, which is a colossal response to the emotional needs and social problems that trouble them. It's also a very narrow response, which excludes a huge number of options. If a kid insisted that their solution to feeling weird or unhappy in their own skin was to cut off a finger, we would recoil in horror and we would refuse to help them do it. This would not be disrespecting the child's reality. It would be a responsible reaction to the kid's distress, protecting them from their own primitive beliefs in response to strong, unwanted feelings. Whether they realize it or not, kids depend on us for that. Which brings us to school. Public schools are now encouraged, and in fact in California required, to deceive parents. An increasing number of school districts, including Chicago, Albuquerque, Las Vegas, are now using gender support guides for school personnel to communicate with students. And parents are typically left out of such plans. Indeed, some schools actually create two sets of documents about students, an alternate gender-focused one for internal school use and an ordinary one for parents. Some parents are therefore actively deceived about the special gender-focused way that their child is being treated at school. Just imagine if a 10-year-old decided that taking math class was totally traumatic and the sympathetic school arranged for the kid to be excused from math class, and not only did so without the parents' input, but then lied to parents by implying that the kid was taking math class. Everyone would think that this is outrageous, even people who hate math. Instead of being neutral, the forms behind these school gender plans promote an alternative gendered view of the child. They use expressions such as student's gender identity, student's gender assigned at birth, student's gender status, and student's authentic gender. These are part of an ideological narrative, not descriptions of a child's actual distress. These forms and the resulting plans also evaluate parents' support of a child's alternative gender story. Parents are rated on a scale of 1 to 10 from not at all supportive to highly supportive. With the chutzpah of religious zeal, these plans ask, if parental support level is low, what considerations must be accounted for in implementing this plan? In other words, how do we get around the parents in implementing a child's demands about their gender identity? Imagine that you're the parent or guardian of a child who insists on adjusting a fundamental part of their life, and that your child's school is wondering how to implement a helpful plan that excludes you. Chilling thought. Note that many schools now have a process for changing a student's name and gender description in their health record, which can be done without parental permission and, even worse, without informing a parent. Gender support plans also evaluate how urgent is the student's need. Is the child currently experiencing distress regarding their gender? Note that there's no psychiatric or medical or other professional evaluation of what's actually bothering a child once they declare that their upset is about gender identity. With this kind of school plan, they are simply reaffirmed. Distress, of course, is a pretty low bar, especially for children, and of course, it is not defined. Imagine a different scenario. What if a kid is experiencing distress about wearing glasses or being short or being Italian? Are they handled with a confidential support plan? Of course not. Today's evolving approach privileges issues of gender above all other aspects of a kid's life, and it doesn't question if gender change or affirmation is the right response to a kid's distress. All a kid has to do to get adult attention in school now is to see gender issues as the source of their problems. As we know, when children are unhappy, they'll grab at any domain that adults currently value, and in today's schools, that means gender. So, if a 10-year-old keeps falling asleep in class or is consistently late or smells like feces, the school can notify the parents whether the kid consents or not. If the kid insists on being called a different name or threatens violence or suicide if required to go to the gym class matching their birth gender, the school cannot notify the parents. So, if a California kid is hiding their gender distress from their parents, their school is now required to actively participate in the secrecy. This is the opposite of what we usually teach kids, that they shouldn't keep secrets from their parents, especially about important things. The potential danger of outing gender distressed kids to their parents is both overblown and disingenuous. If a kid's gender distress is common knowledge at school, the kid is already out to everyone except the parents. Yeah, some kids are emotionally abused or even ostracized by their family. But most of those kids aren't trans. They're kids whose families consider them too sexual or too mouthy or just too damn much trouble. Of course, a few would-be trans kids are in that category too. But we don't withhold information from the parents of non-trans kids as a way of protecting them from rejecting parents. There's no reason to do so with the parents of trans kids. How would most people feel if a child were continually bullied at school and the school decided to handle it without notifying the parents? Or if the kid were flunking most classes or had a behavior problem? Here is School Administration 101. Don't hide things from parents. The first step in dealing with children who are unhappy about their gender is to understand their unhappiness, not to agree with their self-diagnosis, and to affirm their ideas about how to resolve their anguish. Agreeing with every child who says that gender is the problem and the solution creates demonstrable harm for a lot of these kids. No school policy can possibly be 100% cost-free. It is not transphobic to treat kids who genderize their distress the same as kids who develop other sweeping strategies to resolve their distress. It may gratify school officials or political activists, but it doesn't take kids' struggles seriously enough, and it is disrespectful to parents. If changing gender identity is indeed the best or only way to deal with a kid's distress, it will become clear within just a few years of investigating various approaches and solutions. Assuming that it's the best or only approach to childhood unhappiness without looking at a wide range of less intrusive, less life-altering interventions is bad education, bad medicine, bad therapy, and bad public policy. I'm Dr. Marty Klein. Thanks for joining me. I drop a video like this every 2, 3, 4 weeks, so hit the subscribe button. Don't forget to say, I like this video, and I'll be in touch soon. In the meantime, you can also check me out on Instagram, on Twitter, or X, as it's currently called, and you can also go to my website at www.sexed.org. Thanks for joining me.